Hey guys, Dr. Seth here from Great Works Chiropractic, and I've had a lot of people come in here who have had lingering hip pain that goes along with that has went along with their low back pain that needs a little bit of work. And so I'm going to explain to you first a little bit of why I've recommended this video to those of you to whom I've recommended it, and also what the mechanisms are, what we're trying to combat here. Okay, so when there's a problem in the low back area, that creates some type of pressure or irritation to the nerves that power the hips. All of your muscles are powered by nerves. Your hips are no exception. When when you have a problem that's a little bit more to the left of your back, it'll bother the left hip a little bit more. Right, the right. This is how it tends to go. Once that starts to happen, and we get the tone in the muscle starts to go up. It gets irritated. It gets hypertonic. It gets spasmed. It never gets to rest, and it never gets to heal because it's always a little tight. It's always a little contracted, and that's irritated by something that most of us do a whole bunch every day, which is walking. I want to mess up the film here, right? But show you. And what is walking? But it's standing on one foot over and over again. So the muscles on the side of your hip work to keep you from falling over. Now, because most of us are not athletically running through the woods chasing after a wild gallophulant that we want to kill for dinner or what have you, we're not doing a lot of sticking and moving, things that maybe you might have done in football back, or cheerleading practice back when you were in high school. A lot of us are just kind of walking around like just like modern humans. So that means that these muscles here, they never get to move. They just statically contract. So that adds to the stress because they never get to go through the full range that they have. They start to tighten up and they start to get stuck in that shortened, contracted state. So this hip mobility video is going to be designed at stretching to help your body remember the range of motion that it's supposed to have and use it. Because if you don't use it, you lose it. That's true with everything in your physiology. It's an absolutely draconian concept, and it's never fails, right? So we've got to use it. So our hip doesn't only do this. It also does this. We need to use that to keep it safe, to keep it mobile. Okay. So the first things I'm going to show you are a couple of stretches that are very useful for this, and then a couple of motions that are very useful to help with this. And that'll help in addition to what we're doing to unlock your hip for you. Fair enough. Okay. So the first thing I'm going to show you, there are many versions of this. I'm going to show it to you standing because I'm standing to do this video. Is a figure 4 stretch. But I think you can imagine if you were sitting down, same thing, right? You would have your leg crossed over your other leg like this. And for the standing version, which also gives you a nice little balance element, you keep your foot flexed, and then you just stick your butt back and sit down into it until you feel a really great stretch all down through here. I'll show it to you from the side. So I'm doing my left leg here. It looks like this. This is my balance for video, for all of YouTube to make some type of comment. Look how clumsy Dr. Seth is. Oh my God, he should be making videos. Well, anyway, so there we go. And you hold that for, 10, 15 seconds. You can even help to give a little pulse at the end of it to help loosen that muscle up. Just a quick little action like that. Nothing that's going to pull anything. Just a little bit extra to help your muscle let go. The other thing my professor that taught this to me had a different name for it. I'm going to rename it because I don't think it's totally appropriate for YouTube. That was to help kind of get the side of the hip, but a little bit toward the back. This is going to get the very side of the hip right here. So what I call this is the sexy hip stretch. Right? So what you do, let's say I want to get this left side. Okay, this is my left. I'm going to put the left foot around, or left leg around behind the other one, crossed like that. And then I'm going to basically put my hands on my hips to make sure that they're what's moving, and just stick my hip out. I'm keeping the rest of my body pretty much in line. I'm just kind of jackknifing over as far as I can. And I can feel that all the way from here, all the way down to the side of my knee. You don't want to do like this. That's cheating. It'll take all the pressure off. You want to go just straight to the side. Let me show you from the side what that looks like, right? Again, I'm doing this left hip. this foot comes behind, and there we go. And you just stick, the left leg, the left leg goes behind, and you just stick your hip out. Not like this, that takes all the pressure off, but straight to the side like that, so your body is still pretty straight up and down. Okay. That helps unwind some of that static contraction that we get from walking around all day without moving our legs in this direction. The other two things you can do are to help those muscles become dynamic. Once you help unlock that range of motion, now you have to use it. My two favorite things to do are, one, leg swings. Hold something so you don't fall over to do this, okay? And what you want to do is just stick your leg out in front of you and swing it as far as you can from side to side, all the way out, all the way in, so that it gets that, it works these middle muscles, it works the side muscles, and it works them dynamically so that they work in a range of motion instead of just clenching down like that, right? Because how many of us are dealing with problems, just tightness, just constant clenching. We've got to let go of the clenching and allow movement to happen. So leg swings, number one. Number two, especially for you runners out there, is something called grapevines. I don't know how we're going to get this on video. You may need to follow me a little bit, but basically that involves stepping in front, stepping to the side. So I'm using my left leg here to step in back, right leg to the side, left leg in front, right leg to the side, right? And the other way, same thing. Front, back, front, back, right? Speed it up, it looks like this. You can even make it wider to get more mobility out of it. Okay. So that's your hip mobility. What that's going to do is help unwind a lot of the this isn't the right word for it, but I'll use it anyway, spasm that happens from low back problems that start to affect the hip. It's going to start to unwind some of that static contraction that you get from just walking all around all day like a modern human. You get a little bit of that primal blood flow going for you. Wake up those hips, open them up, make it so they don't feel so tight and sore and painful. So if you've been assigned this, good luck. And let us know if you have any issues. If you can't do it, we're always available to help you modify. We know a lot of things. I'm sure we can help. If you don't know who I am and you're just watching this because you randomly searched it up somehow, don't take this as health advice because I don't know you and I don't know your personal situation, okay? But at the same time, I hope it's useful information for you as you try to work together with your informed health expert to make sure that you're doing a program that's safe for you. All right, thanks. Over and out.